Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, I'm trying to track numbers from week to week, but it's hard to keep track of if we're improving, staying steady, or declining. So I'm going to leave that up to you. Currently, where are we in Champaign County?
Okay, so right now we have a total of 639 active cases and 944 in quarantine. If you're just going to watch one number, you might want to watch like our 7-day positivity rate. That right now is at 7.3%, and our region 6 is at 8.9%. So while those numbers are much improved over what they had been at one point, they are creeping back up, but that was to be expected because of the holidays. Currently we have 9 hospitalized Champaign County residents, and as you know, we have had 88 deaths. Kind of the exciting part of this is that the vaccines, we have been getting people vaccinated. As of today, well, as of this morning, so our population in our county that's eligible for vaccines right now due to their age, so basically 16 and up, we have 172,760 people who are eligible to get vaccinated during this, rollout. We have currently vaccinated 5,322 people, and that is 3.08% of those who are eligible. Those numbers will change, constantly, because as we get more vaccine in, as soon as we get the vaccine, we're going to get the vaccines in people. The limiting factor and why I can't give a really good answer to when will I be vaccinated, is because it all is dependent on how much vaccine we get into our community. I can assure you, if we got 172,000 vaccine doses in tomorrow, our community would pull together and we would do vaccination clinics around the clock until everyone got them. But another factor that will be making things a little bit confusing is that we're almost ready now to start the second dose on the first people vaccinated in healthcare. So what the people need to know in the community is when they are getting close to being eligible for vaccination, we will reach out in all kinds of ways. So just hold tight and you will be hearing about it when it's getting close to your time to be vaccinated.
To add a layer of confusion, one of the vaccines has a 21-day period in between, and one of them has a 28-day period. Is it up to us once we get the first dose to track when we need the next one? Or is that something that if your doctor's office administers it, they will call you to bring you back for the second dose?
We have all kinds of ways to help people remember to come back for that second dose. We can reach out to them if they give us their text message or text, phone number, whatever, we can do that. But you'll also get a card when you get your vaccine that will have the type of vaccine you got and the date you need to return. We also have ordered a lot of silicone bracelets, kind of like a little bit fancier hospital bracelets that we can write the information on, and people can have those. If they choose to use those, they can. So I don't think people that are looking to get the vaccine, I don't think too many are going to be forgetting that second dose. So they'll be reminded multiple times.
Let's go back to the numbers that you gave us a second ago. With Champaign County, 7.3% positivity rate, we have come down. That's great news. But overall, the counties surrounding us, have they gone up? Are they just holding steady? Why are our numbers above 8%, which is the threshold?
Well, so that's for the region, but the region was really high for a while, and so were our numbers. I mean, right before Thanksgiving, our numbers were very high in our county. So we've been doing a lot better. We had been a lot lower right after a couple of weeks after Thanksgiving, but then with the winter holidays, the Christmas holiday, and the travel and gathering involved with that, it is going up some, not horrifically. So yeah, I mean, but that is important to understand that the counties around us also greatly impact our region and when we can move to the next level. But they are doing better. If you look at the numbers, there was a while where the only, blue state that was meeting the guidance, the guidelines or the numbers, was Champaign County. And then that's sort of expanded. And now I think out of our 21 counties, I believe we have 7 or 8 counties right now that are not in the warning zone. So that's good. the southern part of our region is not doing well. So, but then again, they're not trying. So the health departments are trying, but they get no support, and that makes all the difference.
Can we make a correlation between mitigation efforts in our area, closed restaurants, mask wearing, social distancing means a lower percentage rate? The southern part of this region, restaurants are in person, people are not social distancing. Isn't that the textbook case of the lack of mitigation efforts and why the numbers are increasing?
I mean, yes, you can definitely see the change when the tier 3 mitigation went in. Our whole entire state was really a mess as far as numbers go. Give it a few weeks after that, and then they start going down some. I'm still very sad and disappointed in the number of deaths that we're still seeing. And I wish people would just hang tight and take this seriously and make it through until it's time to get vaccinated and beyond. So it is just not the time to let your guard down. And we're in January now. We're in a new year. I'm super optimistic that things are just going to continue to get better and get better and get better. Are we going to have glitches? Of course, of course we will. And I do look for at some point the vaccine rollout from the federal governments to the states to make more sense and to be more equitable and more efficient, because that's not where we are right now. But all I can say is as much vaccine as we get into our county, we'll immediately get it into people. We have, Carl's working with us, U of I's working with us, Christie, OSF, Francis Nelson. I mean, everybody's working together. We have EMTs from the U of I that can help us vaccinate. Probably not. I don't think they're EMTs, paramedics. I always get my terminology wrong, but we have a lot of support in this community, and we have a lot of people who are eligible to provide vaccinations. And I've had nurses that have worked here years past who have reached out to me that they still are licensed. They want to come back in, get some just-in-time training and help out with the vaccination as well. So it's not an issue of not having enough vaccinators or not having enough staff to do it. It's just the limiting factor is 100% vaccine.
I'm glad you brought up the U of I, because in September we saw a spike when students came from all over the country, and they're heading back here in a couple of weeks. Are you worried about another spike of students coming from states with, how shall I say, less strict mitigation efforts? Are you worried about that?
Well, no matter where they're coming from, they're going into an environment of strict mitigation and actual enough testing to keep track of this. So I'm not concerned about that. I mean, hospitalizations, deaths, community spread, that's concerning. But for just the U of I coming back, I mean, we've done that. We've seen how that went. We've already done it in the fall. So it's just going to be a lot more of making sure that, they're not having parties and gatherings and things like that, because just as far as them coming back, they'll be caught early if they're positive, and then they'll be in isolation and others in quarantine. So we've done it. We know we can do it again. So we just have to stay on top of that.
There's another drug company, Novavax, that is now in stage 3 trials. Are you confident, dare I say, hopeful that everyone who wants a vaccine by the summer possibly will get one?
I certainly hope so. At least, in our county. I mean, there doesn't seem to be any issue at all with vaccine production. I mean, they seem to be cranking it out. I think the issue has to do with, logistics of getting it from there to here and to the locals and into people's arms. Like I said, if we could go over and get like a boxcar full of it today, we would make sure that we got it into people's arms as fast as possible. So they've got to work out the issues at the federal level. So, and I am hopeful that will get straightened out here pretty soon.
I am hopeful that teachers are bumped higher on the list. I've heard from a lot of teacher friends, they're nervous to go back to classrooms without being vaccinated. Is that something that's on your radar, is getting teachers and kids back in the classroom and putting them higher on the list?
Yeah, The reason, so they can, kids can be in school and do it safely as long as they are doing the spacing, the distancing and the masking and doing the things that they know that they need to do. That's really where the issue would be with outbreak, and we haven't really seen that, knock wood, very much. We've seen little outbreaks, but often it's associated with an outside sport or them bringing it in. So yes, but teachers are in the next category to be vaccinated. So 1B is the category, but so are a lot of other people. So it's just one of those things where we just have to start knocking out the different categories, one at a time, and trying to make sure that everybody who's eligible get the vaccine. I just ask the community to continue to be patient. Like I said, there will be glitches. We have a lot of vaccinator agencies and places working with us, but I do wish that the long-term cares were getting vaccinated a lot faster, but that again is a federal contract with pharmacies, so we have no control over that at all. But that would be a priority. Obviously, any group that you're seeing a high death rate in is a priority. But as far as teachers and students go, teachers are in the next group, and they need to just go ahead and follow the same mitigation. I think that there will be, we asked them to stay out for over the holidays, the holiday times, which they did, most of them, and that's worked out really well to help keep the numbers down. But I do believe that they will be starting a lot of them in January.
For people who can't wait to get back to in restaurant and in person and in movies, what has to happen in our region in order to make that happen?
Well, we have to get the numbers. I mean, it's all on the Illinois Department of Public Health mitigation information site, but what would really help, I mean, it's just, again, our county, I keep saying, is doing a really good job, but we need to see that replicated throughout our entire region and throughout the state, because that impacts everyone. So if we need to get the positivity rate down, and we need to make sure our hospitals are being protected, and so that we don't run into what we saw earlier in the spring in New York and what we're now seeing in California. We don't ever want to get into that type of situation. So, and we did see that when the governor instituted the tier 3 mitigation, that it did make a difference, and our numbers did come down even over the holidays. So we just have to keep doing that.
So last question before I let you go. If somebody is wondering, well, when do I get my vaccine? What is your general blanket answer to them?
Well, I can give them a halfway decent answer by having them go to our website and click on our vaccination page. There's a little, on our website, there's a little graphic that says vaccinations. If you click on that, it will show you that information. And then it's sort of more of a general overview, but if you look at that, it'll kind of show you where you are. What's not there, and what everyone really wants to know, is what's the time frame. And that's what we cannot say, because we don't know. Again, if we had all the vaccine right now, we could give you a time frame, because we know down to the hour how many people we can crank through to get vaccinated. This many vaccinators, this many hours, how many you can get in a day. But we don't have any idea of the vaccine amount we will get. So that is the problem. That's why I can't give the kind of answers that I like to give, which are more specific. Illinois Department of Public Health has a website where you can look at the entire, state vaccination plan, and then you can go in there and it's a little more granular, if you will. You can see more information. It doesn't just say critical workforce. It really lays out what is a critical workforce. But what the community needs to know is that as we get close to you, whether you're at a job site or whether you are, somebody that's over 75 years of age or whatever, we will be getting that information out to people. I can say that what we're planning for people right now over 75, which is coming up in the next group, is we should have a phone number for people to call to make an appointment, as well as a online application if they want to speed things up even more. And at that time, then we'll be telling people where the vaccines will be given.
Okay, I'd like to, for a future segment, have Urbana Mayor Diane Marlin on to get her vaccine while we're all together so that we can see. It's a small needle, and she would like to show people. Maybe we could talk Mayor Marlin into that. Also, Jason Liggett, our producer, he is willing to take it on screen as well. Julie Pryde, I know that you keep saying, put me in the back of the line. I want everyone to get it first, but we need you to stay healthy. Julie Pryde, Administrator of the Champaign-Urbana Public Health District, thank you for everything you've done.
Thank you. And to be clear, when I say put me at the back of the line, I mean put me at the back of the line at public health. So within our groups, we're where I stand as a critic. I mean, I'm not a frontline public health worker, so I would go more into critical infrastructure, which is where the mayors and everybody else would go as well. I'm not front facing, dealing with sick people all the time. So that's what I mean by that. I will, I'm not a martyr. I'm not going to be the last one up, to get it, but I will not skip ahead in line, nor will anyone in our agency. So that's all we can offer, out there, is to let people know that we will be as transparent as possible. We try to answer as many questions as possible, and just to urge people to continue, doing what you're doing, because you're doing a great job, and be patient and be optimistic, because things are going to get better.
Thank you, Julie. We're so lucky to have you. Thanks for your time today.